I am Dr. Gandhi, kidney specialist at Bridge Kidney Hospital and Justop Hospital. Some of the questions which are asked very frequently by our patients, we will go into detail and find out what are these and what are the answers, so that you may have solved your problem before seeing anybody else. First and foremost question is asked to us is, what are the kidney functions? Everybody knows kidney purifies the blood. Therefore, it removes the toxic material from the blood, what is called as blood urea nitrogen and creatinine. This is very common knowledge, and this is the most important function of the kidney. Not only kidney does that, but it also removes excess water from the body, which we consume many times than required. Therefore, excess body water also is removed by the kidney. Not only it removes the water, but it maintains what you call acid-base balance. It removes all acidic material which is consumed by us, so that patient does not go into acidosis, and therefore pH or the normal hemostatic material is maintained in the body. Not only this is the important function of the kidney, but other two functions which is not very well known are, it maintains the hemoglobin or the blood cells in the patients by producing what we call erythropoietin. When the kidney is normal hemoglobin is maintained by production of erythropoietin. But when the kidney gets damaged, the erythropoietin is not produced, so the hemoglobin goes down, and almost all patients with kidney failure develops low blood count. That is the reason many of the patients develop low hemoglobin. Other important function of the kidney is maintaining of the calcium and phosphorus metabolism. Kidney activates vitamin D, which we consume normally, to activate vitamin D formation. When the kidney is damaged, this is not formed, and so that the vitamin D level goes down and patient's calcium level goes down, and they develop what we call secondary hyperparathyroidism that removes the calcium from the bone, so that many of the patients who have got kidney failure have got low calcium and they require the calcium and vitamin D supplements. Other question which is asked frequently by the patients is, what is the chronic kidney disease? There are two types of kidney diseases. One is what we call acute kidney disease or acute kidney failure, or acute AKI what we call it, and second one is CKD or chronic kidney diseases. In AKI or acute kidney disease, kidney fails temporarily, maybe because of a dehydration, maybe because of infection, because of sometimes the medication side effects or blockage of the kidney it produces, and patient develops kidney failure. If you treat the original disease like infection or removal of the drug which is given after kidney failure, kidney recovers. Therefore, what we call acute kidney disease is reversible. It does not require permanent dialysis. Sometimes with acute kidney disease, patient may require 1 or 2 or 3 dialysis till kidney settles down. In chronic kidney disease, what we are dealing with, what we call CKD, kidney disease gradually deteriorates over the time. It may take few weeks, months, or even years. And this is generally what we call irreversible kidney damage, and when the kidney fails to the extent of 95 or 90 to 95%, patient will require permanent dialysis. The next frequent question asks, what are the causes of CKD? CKD, there are 5 important causes of CKD. The first and foremost in the Western country is diabetes mellitus. People think diabetes is only sugar problem. That's not the case. Diabetes does produce sugar problem, but it also affects kidneys, heart by producing heart attack, retina, and also stroke. So that it is not only sugar problem, but it is a multi-system involvement problem. and that is the commonest cause. In India, it used to be not very prominent percentage, but now it is catching up like Western countries, and it is first and or the second cause of kidney failure. Other important cause of CKD is high blood pressure. High blood pressure in Western countries is known as silent killer. It does not produce problems immediately, but if it is left untreated over the period of 15 to 20 years time, the patient will develop either the heart attack or stroke or the kidney diseases after 15 to 20 years time. Therefore, blood pressure, once diagnosed, should be treated and should be treated adequately. And if you do not take care of yourself, even if you don't have symptoms, it will produce problems in future life. So it is better to take some medication, not only take medication for the blood pressure, but lifestyle modification, tension, salt intake, and exercises will help a long way. Other important causes of kidney diseases are what we call a chronic glomerulonephritis, which is the inflammatory problem of the kidney, not due to infection but due to immunological reaction. And two other causes are stones and the infection of pyelonephritis. Even at times blockage of the kidney because of the stone, prostate in the male patients, or uterine problem in the female patient can give us to chronic kidney diseases in later years. These are the important causes of kidney disease. At times, people have a hereditary problem, what we call a polycystic kidney, and in that, generally, patient between the age of 40 and 60 goes into kidney failure, and they develop dialysis and transplantation. It's what we call autosomal dominant. Therefore, many people gets into problem. 50% of the future generation gets into problem, and they will require dialysis. Initially, there was no treatment for polycystic kidney disease, but now recently new drugs have come out which we to see how it works or not. Other thing is what we call Alport Syndrome, which produces deafness and kidney diseases in patients, and therefore that is an important cause, and that produces kidney failure in the male patients between around the age of 20s with the deafness. Other frequent causes, questions asked to us are what is the connection between the painkiller and the chronic kidney disease? I think all of us gets aches and pains and we require painkiller. The safest painkiller is what we call paracetamol, which is commonly known as crocin, metacin or dolo, which is safe from the kidney point of view. If you have severe pain, sometimes family doctor will give you stronger painkiller, and these are what we call NSAIDs or non-steroidal anti-inflammatory drug. Commonly used brands are Brufen, Voveron, Dicloron, NICE, or what we call a COX-2 inhibitors. These are good painkillers and are reasonably safe if it is taken when it is needed for a very short time. But if it is consumed for a longer time, it produces irreversible kidney failure, and if you do not withdraw the medication, person can develop a kidney failure which will require for dialysis. The best thing is if you got a pain, please get evaluated completely before start taking the medication. If the doctor gives you medication to relieve, see that you take it only when it's needed and stop it as soon as you are better. And if you take this medication for a long time, you can go into kidney failure. The safest painkillers are, as I told you before, paracetamol, which is known as crocin, metacin or dolo, or what we call Tramazac or tramadol, which is known as Ultracet or tramadol for the painkiller. This you can take it safely if required. Next question, frequently questions asked to us is, what are the treatment options for the patient with CKD? CKD questions, when the question occurs when the kidney fails, 90% or more only treatment available is dialysis or a transplantation. But this is CKD stage 5. But if CKD stage 1, 2, 3, 4, 5, then person needs to be treated by the nephrologist with the proper treatment of the original disease, which is given to kidney problem like diabetes, blood pressure, infection, or some of the drugs which is given to kidney problem to withdraw the drug that can help it. Otherwise, the other treatment for the CKD early stages is diet control, which involves protein restriction. In this, many times patient goes and cut down the protein completely, like milk, dal and non-vegetarian dishes. That's not required. You have to avoid excess protein. All of us needs 0.6 to 0.8 grams of protein per kilogram body weight. And so that in vegetarian patients, 2 to 3 cups of milk is allowed per 24 hours time, and dal and pulses in a limited quantity, half vati, may be allowed. But when the kidney disease fails and the patient's creatinine clearance, or what we call a GFR, glomerular filtration rate, goes below 5 to 10, patient has only 2 options available to them, that is lifelong dialysis or a transplantation. Dialysis are of 2 types. One is what we call hemodialysis. This is required 2 to 3 times a week. Either you can do it at home, or even you can do it in the hospital settings. Home dialysis is preferable many times, little more expensive, but it can be done at convenient time and patient can do much better. Otherwise, patient has to go to the hospital. Other type of dialysis is what we call a peritoneal dialysis, which you can do it continuous ambulatory peritoneal dialysis, that is 4 times a day it is done, and it has to be done morning, afternoon and evening and night. It takes 40 minutes to do it, but 4 times a day it has to be done and patient has to go on. Other peritoneal dialysis is what we call APD, or automatic peritoneal dialysis machine, which is small machines are available. It costs 4 to 5 lakhs of rupees. But you can connect yourself with the peritoneal dialysis by putting in a tube into the abdomen, connect it up at night, disconnect in the morning, and at the whole night the dialysis goes on when you are sleeping. Morning you can disconnect it and continue with the daily activity. CAPD is good for very elderly patients and very young patients, and person who is not staying near the dialysis unit, therefore that will be a good option for them. But in India, CAPD or peritoneal dialysis is much more expensive than hemodialysis, and chances of infection rate is higher in peritoneal dialysis. No doubt, with the quality of CAPD bags and other knee is improved, infection rates come down, but is still significantly higher. So that you have to be very, very careful when you are doing CAPD. The next question asked is, are there any diet restrictions? Diet restrictions in a kidney patients, as I told you before, in the CKD stage 1, 2, 3, 4, protein restriction is required, where you have to cut down the protein by milk and dal restriction. On the day you take small piece of chicken, fish, you will cut down the milk correspondingly. Other diet restriction, which is very common and you should be followed up very closely, is in India. Common customer is, if your kidney is not working, take plenty of liquids and take coconut water. These are 2 injurious things, in my opinion, in the patient with a kidney problem. If you take more liquid intake, you will get swelling and you will get into more breathlessness and you require early dialysis. And coconut water is good if patient has got low potassium, but most of the patients has got high potassium, and this is very injurious because high potassium can give us adverse problem in the kidney patient. So that you have to be very careful. Other thing is to avoid excess salt in the diet. Take liquid intake as required, and then you can do very well. What should be CKD patients take care of themselves? As I told you before, diet restriction, treat the original diseases which is given at the kidney problem, If you take care of that thing, patients will do well, in my opinion, for a long time. Not only this, but when the CKD stage, early stages, they should be get vaccinated for hepatitis B, because hepatitis B is common in dialysis patients, so that they should get vaccinated. And that not only that, they will require other vaccination like influenza vaccine and pneumococcal vaccine should be taken to them at a yearly interval, and they will require iron supplements. And as I mentioned before, that many of the patients with the CKD has low hemoglobin, and only response they will respond to is by taking injection erythropoietin. Injection erythropoietin is taken once a week or twice a week or once a month, depending upon the brand you use it. But this will require, and you should maintain the hemoglobin around 10 to 11 grams per cent, then you will not feel weak, breathlessness and chest pain. So you should take care of yourself with a diet control, fluid control, salt control, take medication, control your blood pressure 120, 130 by 80, control your diabetes very well, and take the medication as required for the original diseases and maintain your hemoglobin. If you do this thing and in spite of that CKD progresses, then what you should do is to get AV fistula done when the creatinine is around 4, 5, 6. So when the dialysis is required, you will be ready for dialysis by putting the needle. Otherwise, you will end up in the ICU and putting the lines in the neck, and it will unnecessarily cause a lot of tension to the patient and the family. So that I think you should vaccinate yourself if you got a CKD and prepare for the dialysis mentally, physically, by doing fistula, and financially. And other treatment what you should do is, if the CKD is progressing, to think about doing preemptive transplantation also. Myths and facts about the kidney diseases. Many people say that my kidney is failed, so I will die. I think what you should know is the end of kidney, not end of life. If the kidney fails, you can still have a near normal lifestyle with regular maintenance dialysis and or transplantation. Life transplantation is a good alternative. It produces better quality and the quantity of life at any age of the patients, and is tolerated well by most of the patients unless heart disease or infection is not you are able to do it. In India, we do the transplantations with a live related donor in majority of the cases, but we are doing more and more cadaveric transplantation. The problem with the transplantation is many people are worried that if I give kidney, I may end up on dialysis. What I would like to say over here is, we evaluate the patient completely before anybody can act as a donor, and if all the reports are normal, we can say 99.9% he or she will not get into problem. Other thing, people say, I'm a male patient, how can I take kidney from the female patient? There is nothing like a sex for that. Male can give a kidney to the female and female can give it to the male. There is no problem at all. And person after the transplantation can have a near normal lifestyle. They can work normally, they get married, and they can have a normal kids also. But only one thing I would like to say over here is transplantation, you have to be careful throughout your lifestyle. You have to take the medication regularly, and the cost of transplantation is expensive. I would like to say over here is the per dialysis cost in India anywhere generally is 20 to 30,000 rupees per month hemodialysis. Peritoneal dialysis will cost 30 to 40,000 rupees per month, and transplantation may cost anywhere from 5 to 10 lakhs of rupees. But per month expenditure will be later on will be about 5 to 10,000 rupees per month lifelong, and they require regular follow-up. Again, I would like to say the quality of life and quantity of life is far better with the transplantation than life on dialysis. Any patient who has a kidney failure should think about doing a transplantation if he or she is medically fit by the concerned nephrologist, and the life is much better. We have done the transplantation even a small kid as well, as long as 3 years old child, and also in the elderly age group of patients of 75 and above, and they have done well. So that is nothing like it that you are too old or too young for the transplant. If you are physically fit, you can think about transplantation. I hope I answered most of the questions. If you still have questions, you can still talk to us anytime. Thank you.